Hello, today I will be demonstrating proper oral hygiene education with my patient. We will be touching bases on how to floss, how to brush, and how to use a disclosing tablet properly while following infection control protocols. So I'm going to bring my patient in here and we're going to get started. Okay, this is my patient here. I already did my hand infection control, hand washing thing. I'm going to give her glasses and I'm going to put on my PPE. And my gloves. I'm ready to get started, and I'm going to give my patient a disclosing tablet. She's going to chew until it dissolves and swish for 30 seconds and spit it out. Okay, there's the disclosing tablet, and you're gonna chew and swish. Okay. Now she's gonna smile in the camera. And where you see the dark spots is where you might need to brush more and floss more. Yep, so there are some areas that she needs to improve on brushing more. So I'm going to teach my patient how to floss. I'm going to begin by pulling out my floss. And when we handle the floss, we want to wrap it around our middle finger and have our index finger and our thumb touching the floss so that we could press the floss between the contacts of the teeth. And then once we set up our floss, we're going to go in between the tooth and do a C shape. I'll present it on you. Open up, between and under the gingiva as far as possible in a C shape. So up and down in a C shape under the gingiva as far as possible. I'm going to change out my gloves and I'm going to give my patient some floss, and she's going to demonstrate the correct way how to floss. She's going to do that on all of her teeth. Run out of floss. Okay, perfect. Change it out. Gotta change out your gloves. If you touch anything, you have to switch them out. Go.
So you wrap it around this finger, and then you take these two.
Yep.
And make a C shape.
Yep.
And go up and down.
Up and down and C shaped. And you're gonna do that everywhere, on each side of each tooth. Up and down, C shaped.
Okay. Up and down, C shape. Up and down.
And you can throw that away there. Now that I've taught my patient how to properly floss, now I'm going to teach her how to properly brush. I have a new toothbrush here, soft bristled by Colgate, is what I recommend for her because it is soft on the gum and it's soft on her enamel as well. She mentioned to me that she had some sensitivity. That might be because her enamel is stripped. So I'm going to recommend some Sensodyne Pronamel that will help remineralize her enamel. So I'm going to give this to her. I'm going to put on some toothpaste on it, and I'm going to help her brush. Now, when you begin to brush, you're going to brush at a 45-degree angle for 2 minutes, and you're going to go in a circular motion.
Okay. So 45-degree angle, that's this. Circle.
And you're going to do that everywhere around your teeth, around your mouth, for 2 minutes. And you want to make sure you get the full facial of the tooth, the front of the tooth and behind the tooth. And when you go behind the tooth, you want to go in vertically and brush upwards to get the biofilm and the bacteria off of the tooth. And also the tongue. Also the tongue to release the bacteria.
Mm-hmm.
And she's going to do that for 2 minutes.
Mm-hmm.
Also, when you're brushing, you want to make sure you go circular motion on your gums too. Make sure it's 45-degree angle. Make sure it's vertically inside of your mouth once you get behind the tooth. And that is how you do a patient education oral hygiene video. Like, get your help. Thank you. Goodbye. Until next time. Oh, for this patient, she only brushes once a day. I recommend night and day. And that's it. Thank you. Goodbye.
I need to get the mouthwash.